We do have about 5 minutes. If there are any questions, please feel free to come to the mic, or comments on your own successes or challenges with treatment of patients with pelvic symptoms after cancer treatment. I do have a couple of questions. One is for Dr. Buxbaum. If a gynae-oncologist was going to do a surgery for endometrial cancer and a patient has stress incontinence and is eligible for say a TVT sling, and there's a possibility of radiation in the future, would you put in a sling, a mesh?
No, I would prefer a birch for this patient.
Is there any data about that anywhere?
We have no data. And we have to collect data because some of the patients, we make similar decision when it comes to sacrocolpopexy. If it looks like the patient is very unlikely to undergo radiation, we use meshes because they have shown to have better long-term results than biological material. However, if there is a chance that the patient will undergo radiation in the future because the pathology is not so clear, we use biological suspension. And we counsel the patient then that the outcome might be poorer than if we use mesh, but then again, we balance the pros and cons of either approach.
Yes. From the floor?
Kari Bø from Oslo, Norway. I have a question for the psychiatrist talking about the female orgasm and the pelvic floor muscles. To my knowledge, there are no really evidence to say that the pelvic floor muscle strength is important for female orgasms or for the contractions after the orgasm. Can you elaborate a bit on that?
Yeah, so again, really the key is it depends on. So often women will have hysterectomies and say there's absolutely no change in their orgasm experience afterwards, right? For the women that say that there is, then we sort of theorize, and I don't have any literature to support that, but we theorize it's because the reflex has been so ingrained to be in tune with the sensations of the orgasm contraction. So we need to we know they're still having orgasm experiences if their arousal is high enough, and we're able to trigger that reflex. So we need to be able to sort of help them anchor that orgasmic reflex in something else. So what else is happening during that? We've got the pleasurable sensations, and we've got the contraction of the pelvic floor. So we want to then use the mindfulness, and that the mindfulness is really key in that, to get them to tune into those contractions. It helps if their pelvic floor is stronger.
But I think we need more research into that to really state if that's truth. And I also think that the contractions of the pelvic floor after orgasm is totally different from a voluntary contraction, because it's more like ejaculation in men. It's more like opening up, instead of when we are asking them to contract is a lift and squeeze.
I totally agree. We're not expecting them to have the same experience. What we're working on is getting them to non-judgmentally accept that things are different and to focus on tuning into the pleasure that is. I can't give them their uterus back. So I can't promise it's going to be the same. Same with the men. I can't promise it's going to be the same, but I can help them optimize their pleasurable experience. And by getting them to be more non-judgmental and have less expectations of how it's going to be different, there is the key. And we do have literature suggesting that the mindfulness will increase their pleasure and reduce or improve their satisfaction with their sexual experience. And we have good evidence related to the gynecological cancer population for that.
Thank you.
Hope that helps.
Good morning, Cindy Neville from the United States. In some centers in the United States, they are doing what we might call prehabilitation prior to breast cancer surgeries. Are there any models of pre-cancer intervention rehabilitation approaches for the pelvic floor prior to gynecologic cancer interventions that you're aware of?
Well, there are none that I am aware of. There might be institutions that do something. We have not done it at ours. I am not aware of any, but this is something that we should consider, and a lot of things we should consider and should do them also under study protocols to really see, is it safe to do this? Is there an efficiency to do this? Is it safe to use mesh in patients who might undergo radiation therapy? All of these things, we have no data, and we're doing and following and looking back and see, did we do any harm?
one last quick question.
Montse Puña from Barcelona. You talk about the evidence with mindfulness. Could you please explain, a gynecologist, how it works? I mean, what is the mechanism? I suppose it's controlling anxiety, but and also what is the method for this treatment? How many sessions and how?
So the evidence, a lot of evidence is by Brotto. So Lori Brotto does a lot of evidence supporting it. Often it's used in a group treatment setting. The evidence to date is following, I think there was initially 4 group sessions for women, and then there was further evidence supporting the use of 8 weekly sessions, typically 2.25 hours long per week. This follows the traditional mindfulness-based cognitive therapy originally developed for depression and stress reduction. There is currently ongoing a couple of studies in Canada looking to see if having 6 sessions over the span of 8 weeks may still have benefit, but we still have to wait to see if that has effect. So typically it's done in group settings, and it's basically we provide psychoeducation on what mindfulness is, and then we start to use the practices. And I don't have time to go through exactly what we do, but once we get them sort of understanding that we need to create a focus of attention on the present moment without any judgment of that, helping them identify when their brain starts to wander off and gets distracted by other thoughts, and then redirecting back to whatever the focus of attention is, that sort of sets them up for having that improved pleasure.
Okay, thank you very much.
Thank you. That concludes the session. Thank you. Again, thanks to our speakers. I think you did a great overview.